Why are millions of people developing type 2 diabetes even though they feel healthy? What if I told you it's not just sugar, it's not just carbs, but something else is happening deep inside of your body right at this moment? Type 2 diabetes is exploding around the planet, and in today's video, we're going to be talking about the real cause of type 2 diabetes and how you can avoid it. Stay for more. So as we said before, type 2 diabetes is not just a measure of the bad sugar that you're eating, but actually what's happening is your body's now responding to insulin. And think of insulin like this. You have the car keys. You have car keys that you need, and the door is locked. The insulin is the car keys, and your cells inside of your body are the car that is locked. Insulin is the key that you need in order to get inside that car. But what if I told you for some reason the car keys are not working for the exact model of the car that you got? What would you do then? The act of the keys not going inside the car is called insulin resistance, and this is what causes type 2 diabetes. So if insulin is not working, then why is it not working? What is causing the body to resist the insulin? The first thing is going to be too much fat. Fat is actually very, very inflammatory. Now, it doesn't mean that you should be on a zero fat diet or anything like that, but it does mean that there's a limit on how much fat we should each have. Now, we need to know what fat is. Fat is actually just energy that's stored inside of your body. In the old days when we were hunter-gatherer type of people, we would need fat in order to survive the long periods of time for our bodies that were not getting the constant amount of food over and over and over again. So because of this, now we live in a time to where fat is actually constantly being consumed, but we're no longer moving as much. So because we're still have the skill of our body holding on to the fat but no longer moving as much, the fat is constantly getting stored, and it is actively causing your body to resist the insulin, making you more likely to get type 2 diabetes. Now, it's worth noting that not all fat is bad. There's two types of fat, actually. There's the white fat, and then there's the brown fat. White fat is what is going to make the glucose stay inside of your body, is what's going to give you the energy in those serious times of malnourishment. But the brown fat is actually the fat that is active and can remove the glucose from your bloodstream. And if the glucose is removed from your bloodstream, your high blood sugar will be taken away and lowered. If you have too much white fat, your body's not going to respond to insulin. It's going to inflame your body, making you more likely to get type 2 diabetes. The next thing that's going to cause you to get type 2 diabetes is actually going to be the high amounts of red meat. More red meat, more likely to get type 2 diabetes, especially if that red meat is processed. Now, if you eat lower amounts of red meat that is not processed red meat, either by baking it or air frying it or different methods of cooking it, not in the deep fried oil and things like that, then this is going to be something that your body sees as high quality by not frying it and not processing it. But once you process the red meat, even though you may be someone that is eating correctly, your body's going to be fighting against you very ferociously, because now it has to work a lot harder to fight against the trans fat that's within all of the oils that was put into the red meat. If you're worried about getting type 2 diabetes and you think about eating processed food, stay away. Do not eat processed food. It is a recipe for disaster, as it is high in fat, it's high in sugar, it's high in trans fat, and most likely will lead to you having high blood sugar and remaining as a type 2 diabetic. Now, it may sound as though that you need to just cut out all food in general. There's nothing you can eat, but that's not true. Seeds and legumes are a perfect substitute for the red meat. And you may be thinking, but red meat has creatine, and there are some red meats that do have creatine, and red meat does have creatine. But you can also take creatine as a supplement if you do need the creatine to sustain yourself as well. High quality whole foods that are not processed are perfect diet for type 2 diabetics that will not increase the blood sugar and that will help in the fight against type 2 diabetes. This is one part of the fight, though. If you're going to be someone that fights against type 2 diabetes, you need to be someone that monitors your calories from the foods that you're eating, as well as making sure that after you eat, you're doing some kind of movement. By doing movement, your body's going to take the sugar within your bloodstream and put them into the muscles so that the movement can actually happen. But if you're eating food, even though it may be the good food, the better food, and you're not moving as much, your body has no reason to take the sugar within the food that you ate and put it into your muscles. If you're a type 2 diabetic, movement is 100% necessary and cannot be neglected. Multiple studies have shown that by eating and then walking right after you eat for at least 10 to 15 minutes can be really significant enough to lower your blood sugar spike, as well as constant resistance training. At least 3 days a week of really good resistance training is going to be helping your body build up the muscle. So now there are more places for that extra sugar inside of your bloodstream to go inside of your body and not just stay inside of your bloodstream. Now, here's the thing about exercises. Not all exercises are created equal, but all exercises will put you one step closer to fighting against your type 2 diabetes. When you choose an exercise, you want to choose an exercise that you know you can enjoy and do consistently. Some people like the barbell back squat for working the legs, but some people know that if they have to do that, they're not going to be very consistent. Others like the leg press. As long as you're pushing near close to failure and you're working the muscle really, really well, consistently is going to be enough to increase your muscle mass inside the legs. Leg movement is very, very important. Whether you're walking up and down stairs for cardio or whether you're trying to build muscle in the legs using the barbell back squat or the leg press or hack squat, whatever method you use, be consistent. In regards to machines, using the cycling bike or elliptical, Stairmaster, treadmill, you want to be someone that keeps moving as much as possible. The more you move, the better. As well as never forcing yourself to overdo it. Some studies have shown that by having too many high-intensity workouts, it can actually hurt the process of reversing type 2 diabetes rather than helping it, as it increases your cortisol. Now, cortisol is a stress hormone that increases inflammation and makes your body more susceptible to being insulin resistant. But what we want to do, we want to make our body more insulin sensitive. The more things that you do towards making your body more insulin sensitive, going back to the analogy of making the insulin act as the keys that go inside the car, the easier it is for that key to go inside the car door and open the car so that you can drive it and use it. Regarding exercise, you want to do exercises that you can, not only do you want to do exercises that you can do often, but you also want to really think about the method of how you're doing exercise. Whether you're doing push, pull legs, whether you're doing full body 3 times a week, or push, pull legs for 5 days a week, or push, pull legs upper, lower, be consistent. Do not stop. Keep going. You really, 3 times a week is the bare minimum. No more than 5 is necessary. Now, if you feel inclined to work out every day, make sure it's not the heavy resistance training every day. Your body doesn't need time to recover the muscles that you trained. But some kind of movement every day is necessary. Whether it's walking every day, doing some squats every day, whether it's going up and down the stairs every day, be consistent in the moving. Now, what studies have also shown is that by working out with someone, you tend to work out just a little bit harder just because of the camaraderie effect. Whenever you're with a friend or whenever you're with a loved one or anything like that, just the fact of someone being with you on the journey of moving tends to help you be consistent. Whenever you are feeling low, someone else is going to be feeling high. Whenever you're feeling high, someone else is going to be feeling low, allowing you guys to both build the camaraderie to keep going and be consistent every day. Now, of course, this is easier said than done. It can be a very long process to see the results in type 2 diabetes, but make sure you're tracking everything. How much food are you eating? How much time is you exercising? How is your body responding to the foods that you eat as well? For some people, there are some foods that cause a significantly higher blood sugar spike than others, depending on genetics, age, and things of this nature, things that we really can't control. But the things that we can control is how much sleep we get, the things we eat, and how hard we work out in the gym, along with the stressors that we handle as well in life. But the main thing is also just being consistent and making sure that on this journey, you are being patient. You're not going to see all the changes that you want overnight. But if you stay consistent for at least 3 months, you will see a change in A1C. If you're truly eating better, if you're truly sleeping better, as well as you're truly someone that is moving a lot more, over the course of the next 3 months, you'll see the results and you'll be so glad that you did. Not only will you see the results, but you'll also feel different and be more confident knowing that you're on the right path to completing the process of reversing type 2 diabetes.